Welcome to the North Central Region Emergency Action Plan Training Series. In this short session, we'll walk through Section E, Health and Medical, of the EAP form. This section focuses on how to prepare for and respond to health-related issues that may arise during your event, including medical emergencies, public health concerns, and sanitation needs. By the end of this session, you'll understand how to identify health risks, coordinate appropriate medical support, and ensure basic health and safety standards are in place for attendees and staff. During this Module 4, we will review the questions in Section E, discuss the importance of health and medical planning, and highlight best practices and key considerations when completing this section. We'll also reference the EAP guide and point out supporting resources that help inform your responses. Before we begin, it's helpful to have both the Emergency Action Plan template and the Emergency Action Plan guide available for reference. The Emergency Action Plan form is a tool to fill out when planning an event to ensure all areas of emergency preparedness are considered and detailed. The associated EAP development guide will provide event planners with information on best practices for emergency preparedness. This development guide is a resource to help you construct an EAP for your event. This EAP training consists of 6 modules. Module 1, Event Contact Information and Detail, Sections A and B. Module 2, Event Command and Communication, Section C. Module 3, Weather, Section D. Module 4, Health and Medical, Section E. Module 5, Safety and Security, Section F. And Module 6, Comprehensive Site Map. During this module, Section E focuses on medical preparedness and response. Whether your event is large or small, it's essential to assess medical coverage, know what resources are on site, and identify how emergencies will be managed. Clear medical planning keeps attendees safe and ensures a coordinated response if something goes wrong. As part of your planning process, it's important to consider both the estimated number of attendees and the overall footprint of the event, as these factors directly impact your emergency medical planning needs. Larger crowds and expanded event areas often require more advanced medical coverage and faster response capabilities. Additionally, we'll define key terms used throughout this section. Advanced life support refers to medical care provided by licensed paramedics that includes advanced airway management, medication administration, and cardiac monitoring. Basic life support typically refers to care provided by EMTs and includes CPR, basic airway management, and first aid. Automated external defibrillators. IEDs are portable devices used to deliver an electric shock to help restart a person's heart during cardiac arrest. Understanding these terms will help you determine the appropriate level of medical support for your event. Question 38. Will the event have a contracted medical provider? Details asked. Indicate whether a professional medical provider is contracted and provide their contact information, including organization name, phone number, and email address. Why it matters. Reliable medical support is essential at special events to manage emergencies quickly and reduce strain on local EMS. A contracted provider ensures dedicated resources are ready to respond. Staff and volunteers must be aware of the medical assets on site so they can quickly direct attendees to the appropriate resources during an emergency. Knowing the locations of first aid stations, the capabilities of on-site medical teams, and the availability of equipment like automated external defibrillators. IEDs ensures a faster, more coordinated response that can save lives and reduce the severity of injuries. Question 39. On-site medical personnel and asset inventory. Details asked. List the number and type of medical personnel. Examples include BLS, ALS, EMTs, physicians, and assets. Examples include AEDs, medical aid stations, hydration stations, warming or cooling tents. Why it matters. Knowing exactly what medical resources are on site helps plan for medical needs and ensures that the fastest and most appropriate level of care is provided. This also guides staff and volunteers on when it is appropriate to call 911 versus using on-site medical personnel. Question 40. Are the medical providers able to provide transport? Details asked. Note if medical teams can transport patients off-site, and if yes, how many ambulances or transport vehicles are available. Why it matters. Access to reliable transport is critical in serious emergencies. Confirming availability in advance helps prevent delays in getting patients to higher level care. If on-site medical transport is not available, it's important to take proactive steps to ensure the fastest possible care in an emergency. This may include notifying nearby hospitals in advance about your event, assigning staff to meet and guide incoming EMS units directly to the patient's location, and providing clear, detailed information to 911 dispatchers, including the nature of the injury, exact location within the event footprint, and any immediate care being provided. These actions can significantly reduce response times and improve outcomes. Question 41. Nearest hospital. Details asked. Provide the full name and address of the closest hospital to your event location. Why it matters. Knowing the nearest hospital ensures quick routing for emergency transport and accurate information for responders. Notifying the hospital in advance also allows them to prepare for potential patient surges. Remember, medical emergencies may happen during setup and teardown of your event. If contracted medical providers are only present during the event, staff should know what resources are available and where to receive care if medical assets are not currently on site. Question 42. Are radios being used by medical providers? Details asked. Indicate if radios are being used. If yes, provide the channel, frequency, or communication plan. Why it matters. Efficient communication between medical staff improves coordination, reduces confusion, and speeds up emergency response during critical incidents. The associated EAP development guide will provide you with information on best practices for emergency preparedness and response. This development guide is a resource to help you construct an EAP for your event. This guide closely follows the EAP form to provide context and details about the requested information, explain why the information is essential, and outline the resources available to support emergency planning efforts for events. Contracted medical provider third-party EMS or first aid team on standby during the event. Medical response plan document outlining medical triage, communication, transport, and personnel roles. Medical tents fixed or tented spaces equipped with medical supplies and staffed with responders. AED devices, automated defibrillators deployed across the site for use during cardiac emergencies. Standby ambulances. Pre-staged EMS transport for rapid evacuation to nearby hospitals. Medical communications plan radio channels, call signs, and protocols for medical team coordination. Hydration and cooling resources. Supplies like water bottles, refill stations, fans, and electrolyte kits. Nearest hospital directory. Names, addresses, and contacts for closest emergency care facilities. This concludes the review of Module 4, Sections E-Health and Medical of the Event EAP form. This module helps you identify and document the medical resources needed to keep attendees safe, whether they're available on site, coordinated through a contracted provider, or accessed at the nearest hospital. By outlining key assets, response plans, and communication protocols, you and your team will be prepared to respond quickly and effectively during a medical emergency. Up next, we'll cover Section F, Safety and Security. We encourage participants to complete the remaining EAP training by completing Modules 5 to 6. Thanks for watching, and stay prepared.